the Center for Health Policy and Inequalities Research. I am a professor in public policy and in global health here at the Global Health Institute. And as director of the center, I am honored to be working with an incredible group of faculty and staff and students. We specialize in being able to look at different health problems, health behaviors, health conditions, and really trying to understand what causes the behaviors, belief systems, and we bring together to do this very interdisciplinary team. So when on Fridays, if you were to come to our center, we have groups sitting around a table that include physicians, epidemiologists, statisticians, psychologists, psychiatrists, public health, health behavior people, anthropologists, even at times lawyers and others, and everyone is coming together to look at different problems that are in the world today that are very complex, and understanding how we can look at individuals and communities and understand the patterns of behaviors and what causal factors affect how they're doing today and where we can intervene. And so a couple things that are unique about our center is that we do research where we're looking at people and following them over time and understanding their lives and understanding the life course events that have happened from childhood on. But we also look at places where we can intervene. So we have interventions here in North Carolina and in different countries around the world where we're trying to see if a particular intervention will improve people's lives, improve people's outcomes. And the people who we work with here are truly passionate about what they're doing and really believe, as I do, that research can help us advance in the well-being of humanity. And it's also very exciting to be here at Duke because we're able to work with such wonderful and equally passionate students and help train them and launch them into careers where they may be working in NGO, where they may go on to do research, they may become physicians. We have such a broad array of things that people do. If you looked at the research portfolio that our center has right now, you would see that we're working on issues related to HIV/AIDS, related to mental health disorders, substance abuse, legal frameworks for people with stigmatized chronic conditions, and a lot of work around children who are orphaned and separated, street children, vulnerable children. The underlying mechanisms for the different conditions that we look at, however, are what is really important to us. What causes people to be to not be seeking care when they're HIV positive, or to have difficulty navigating systems as substance abusers, or are the same conditions that would make it difficult for some people to navigate systems who have diabetes and have other diseases. So the disease focus is not as important for our group as the mechanisms for how we became sick and how we interact with that illness and how we interact with medical care systems or other systems if they're available. Another place where I see that our faculty and staff really excel is truly bringing into practice the idea that local is global, global is local. We do almost as much work in the United States with disadvantaged, marginalized populations as we do in other countries around the world. And we work with collaborators from around the United States. And we have research that's going on and interventions and evaluations in places like Cambodia, India. We've been working in Russia. We work in different countries in Africa, Kenya, Ethiopia, Tanzania. We've worked in Cameroon, Malawi. And expect to be expanding. Also, we're starting more work in South and Latin America. So this is very exciting, and as we get our teams, most of the people here work both locally and internationally, and as we learn new things internationally, we see how those apply to issues that we're facing here in the United States and the reverse. So we're always having that dialogue that goes back and forth and learning what might be culturally specific and what is about being humans in the world and is more generalizable. I'm very excited looking forward into the future about including even more collaborators and disciplines. We're looking at bringing people in now from engineering and from different areas around campus. And to continue to work with our students and to face the health challenges that we're confronting in the future.